We will talk something about immunity today. Particularly, this is a rainy season. People are getting fevers, viral fevers like anything, dengue like anything almost. Every alternate fever is a dengue case. So we have to talk about immunity. So immunity which is present in us will definitely protect us from these infections. See, I take example of me 3 years back. 3 years back when Corona came, I was working round the clock as a doctor. I was working round the clock, full of admissions in the hospital, and I didn't care about myself for about 2 or 3 months, and I was totally working for Corona patients. My weight went from 80 to 96 kgs, and my sugars, I was a diabetic for the last 10 years by that time, and my diabetes went up to fasting 290 and post lunch 380 post lunch. I was on only some tablets, morning one tablet, evening one tablet for sugar, but I had to take insulin. My weight, I have picked up my weight by 16 kgs. By 16 kgs, I have picked up my weight. And one more thing is, my BP was uncontrolled. Prior to that also, I was having my hypertension. I used to control it by about 2 tablets per day, but it went up to 4 tablets. It was not getting controlled, and I became hypothyroid. My weight came to 96 kgs. I was frequently getting some infection or otherwise, some body pains, some headache, some body pains, fever, etc., etc. Then I recognized I have to change. For the last 3 years, I changed my diet. I changed my exercise pattern. So 80% I started for the last 3 years only. I am following strictly Dr. Khadar Wali's diet, that is millet diet, and some other people, Dr. P.B. Satyanarayana, he's a cardiothoracic surgeon. He also advises diet, and and one more is Veeramachineni Ramakrishna. There are so many people who are advising good diets. So an alternative diet to normal what you are taking. So I started it, 80% diet and 20% exercise. I started following it. I started following 80% diet and 20% exercise. I left 5 items. For example, rice I totally left. Wheat I totally left. Sugar I totally abandoned, and jaggery from sugarcane I totally abandoned, and maida is one thing I abandoned. These are the main things. And one more thing, snacks I have totally avoided. Snacks which are available outside, packaged foods I have totally avoided. For the last 3 years I have worked on it, and in 6 months, my diabetes came to normal. I was no more a diabetic after 6 months. And one more thing is, my BP started getting controlled with only one tablet. I have reduced by 16 kgs weight, and my immunity has gone to that level that for the last 3 years I don't even suffer from a small sneezing or some fever or body pains or malaise or anything. I am totally active round the clock. So how I could do that? Number one, it is weight. See, our immunity depends, number one, on your weight. Weight is very, very, very important. How much is your weight? How do you calculate your weight? Your weight is very simple. Your height in centimeters minus 100 is your weight. Your weight in kgs. Your height in centimeters minus 100. This is male. For males, this formula is exactly correct. For example, I am 170 centimeters. Suppose my height is 170 centimeters. My weight is, I remove 100 from it. So my weight should be 70 kgs. Like that. If I am a female, suppose for female there is a small formula different. Same thing. For females, it is height in centimeters. For example, 170 centimeters is the height. You have to remove 105, not 100. You have to remove 105. So it becomes 65 kgs. It becomes 170 is her height. So remove 105. It becomes 65 kgs. That is the difference. Height in centimeters minus her minus her minus 100, height in centimeters minus 100 for males, minus 105 for females is their weight, number one. And number two, your abdominal girth, your circumference, abdominal circumference at umbilicus, that is waist by hip ratio. Waist by hip ratio should be less than 0.9, for males, should be less than 0.8 for females, for females. So your girth of the abdomen. For example, you take a tape at the umbilicus, you calculate the circumference of the abdomen, and at the buttocks, you calculate your circumference. So if it is and this weight, this is the circumference, the waist circumference by that hip circumference, weight by hip circumference. If it is 0.9, less than 0.9, it is very good for males. Less than 0.8, it is very good for females. There you can think that you are safe. That is very, very, very important. So one more thing is diabetes. Are you a diabetic? Is it controlled? Are your HbA1c levels below 7.5 or at 7? That is very good. And not only diabetes, hyperinsulinism is an important factor. That means you may not be a diabetic, you are going to be a diabetic, but your body is full of insulin. There is full flow of insulin in your body. There is full flow of insulin in the body, because you are giving such a food which are hyperglycemic foods. For example, your rice, your wheat, your maida, your sugar, your jaggery, your all snacks, they are all made up of that. You are continuously giving food. Your pancreas is acting like anything. Your pancreas is struggling like anything. It is producing very high level of insulin. So hyperinsulinism, which leads to diabetes and which leads to fat in your liver. So diabetes, hyperinsulinism, fatty liver are nothing but just one after the other. And one more thing is, you have to check your thyroid. Once all these complications come, your thyroid also starts functioning less. And serum lipids are very, very important, like cholesterol, triglycerides, HDL, LDL, very, very important. And your BP, you must monitor regularly, at least once in a week. So how I could reverse my weight to just within 3 to 4 months, I could come back to 80 kg, and slowly in another 3 months I could come to 76 kg, and my diabetes is totally gone. I am no more a diabetic. My hypertension, my BP started getting control with a single tablet. Now I am taking only a single tablet, and I am no more a hypothyroid. I have completely recovered, and for the last 3 days I have no fever, I have no sneezing, I have no body pains. I am just actively working for the last 3 years. Now I am 61 completed. Now I am coming to 62 years. I am an active practitioner. I am an intensive care specialist and anesthetist. I am actively working for the last 3 years. Absolutely no, my immunity is at peaks. My immunity is I don't have fatty liver. I don't have diabetes. And all these things reflect your health. That is, metabolically you are very, very, very active. Metabolically you don't have any metabolic syndrome. Then first thing is exercise. 20% depends on exercise. Daily 45 minutes exercise. I have been telling you, it is one day walking or cycling, that is cycling at home or walking outside. The other day you do dand baitak. You do sit-ups and pull-ups for 45 minutes. That is very, very important. And your diet 80%. Stop these 5 things: rice, wheat, maida, sugar, and all ice creams, all milk products, and particularly jaggery from sugarcane. All these things should be, all snacks, all packaged foods, these should be stopped. In that place, you start with millets. You start with millet diet. No packaged products, millet diet. And fermented foods, very important. Fermented foods, these are very important. So 80% depends on your diet. Previously we have done so many lectures on diet also. Please try to, you can see Khadarwali's or my diet classes, please see that. And next comes dry fruits, nuts and oils. Dry fruits are important thing. It's not a must. You can use little amount of dry fruits, particularly when you are exercising in the morning, 45 minutes when you are doing exercise, you can have those dry fruits. Previously at night you have to soak them in water, and you can have some dry fruits. And next comes all nuts, dry fruits, nuts. Oils should be homemade oils, that is your village made oils. Don't go for the shop oils, whether it is til oil, whether it is coconut oil, whatever it is village made oils. You know what are village made oils, you know very well. Don't take these mineral oils which are made in shop, which are available in shops. It is not good. And one more thing is, no antibiotics, no painkillers. No antibiotics and no unnecessary antibiotics, no painkillers, please. Because antibiotics, once you are using unnecessary antibiotics for every small reason, your bacteria in the body, nearly 10,000 different colonies of bacteria are there from your mouth to anus in the 12 feet intestine. In the 12 in your gut, in bacteria in your gut from mouth to anus in 12 feet of intestine are very important in playing major roles in your digestion process, in your converting proteins to amino acids, fat to glucose, etc. So many biochemical process. Once you have a very useful bacteria, once you have a very good bacteria in your body, they are very friendly bacteria and they prevent so many diseases. Once the bacteria are disturbed, they create so many problems. You will land up in autoimmune diseases. Please don't land up in such problems. Most of the diseases are autoimmune. So don't take unnecessary antibiotics and painkillers. And one more thing is oils, I told you, and fresh vegetables like salads. Salads are to be encouraged, because in millets also you have plenty of fiber, and salads also you have plenty of fiber, and particularly the bacteria which are there in your large intestine, they eat this particular fiber. Particularly in your colon, the bacteria which are there in your large intestine, that is the large intestine, they eat your they survive on the fiber. Very important. And you will never develop cancers. And your digestion will be very good. You will not be constipated. There won't be any constipation once you have a very good gut bacteria and very good fiber in your diet. So fruits and lemon should be taken daily. Fruit, at least one fruit per day should be taken. Whatever may be the fruit. Better take low glycemic index fruit like guava, things like that. And in these vegetables also, try to take kheera along with, the till powder, till powder, and particularly the groundnut powder, which are made by the homemade things. In that particularly you can just take along with some ghee. It will be very tasty. Salad should be taken along with our regularly homemade till made powders and groundnut made powders. These are the best. They give you very good protein and very good oil also. And constipation should be, lemon is an important part of your diet. At least 2 lemons you must take per day. And Constipation should be avoided by using good fiber in your diet. Good fiber in your diet. Constipation is your greatest enemy. Okay. Ultimately, vitamin supplementations. Vitamin supplementations. What are the vitamins you are supposed to take? Yes, usually if you are a non-vegetarian, you are very lucky because non-veg can be taken liberally. Non-veg curries can be taken liberally, but not with rice, with millets, and particularly for vegetarians, you need vitamin supplements. But generally, this B complex vitamins are little deficient in our vegetarian diet. So better you can take some B complex like Ginkgovit, Jevit, or Biplex Forte. There are so many medications. Just you can take in a month, you can take about 10 capsules per month, like that, 1 capsule per day, like that you can take, so that you can supplement. B complex is very, very important for human body. And D3 vitamin, Bio D3 is one available outside. Bio D3 0.25 is an important supplement. Once in a week you can take, or if you expose yourself to sun in the morning, at least for your body gets exposed to sun in the morning, early morning, for about 15 to 20 minutes, you need not take any D3 supplementation, because from sun rays our body makes plenty of vitamin D. So, but this can be taken as a supplement. If it is not possible, Bio D3 capsule can be taken once in a week, 0.25 regularly. And calcium for women. Calcium for women is very, very important, particularly after the menopause. Calcium should be taken as a supplement. It is very, very, very important. Calcium supplementation should be taken once a day regularly after the menopause, after the periods are over, for females, to prevent this bone density to be maintained. Bone density, otherwise osteoporosis is the side effect. The bone becomes weak in females. You have to take regularly calcium. All these things, if you are taking regularly, will give you very good immunity. Will give you very good immunity, particularly fresh vegetables, fresh fruits, lemon, all these things they give you. Particularly, leaving these 5 things like white rice and rice, gehu, that is our wheat, all these things, and shifting to millets is very, very important. Millets contain 9 to 12% fiber, and that is very, very important. It gives lot of immunity to you. Immunity lies in what you take, and 20% exercise is a must. Try to